May is Stroke Awareness Month, and Baptist Health wants to get a little jump start on sharing important facts, symptoms, and what you should do if you or a loved one experience any of the symptoms. Here with us this morning is Casey Grimmett, who is the stroke nurse coordinator for Baptist Health, and Dr. Beth Miligan, who knows all too well what happens during a stroke because she has suffered one. Ladies, good morning. Thank you so much for joining me today. I cannot wait to hear your story, Dr. Miligan. But Casey, I'll start out with you first and just say, why is this so important to talk about strokes?
So in Arkansas, we live in what's called the stroke belt. The stroke belt is basically the southeastern portion of the United States where we experience the highest prevalence of stroke. We also have some of the highest stroke death rates. And so it's important to talk about because there are so many people in our state that are suffering from it. We are currently 10th in the nation as far as stroke mortality. We have come a long way. We were previously first in the nation. And so we've come a long way in stroke care.
What exactly happens when someone is experiencing a stroke?
So when you have a stroke, there's basically two ways you can have a stroke, either ischemic or hemorrhagic. During an ischemic stroke, you have a blood clot that forms elsewhere in the body and goes to the brain, or you could have a blood clot that forms within the brain vessel itself. This blocks oxygen and blood flow to the brain and produces stroke-like symptoms. You could also have a hemorrhagic stroke where the blood vessel ruptures into the brain, or it could rupture into the area surrounding the brain.
What are some of those warning signs to look out for?
So we use the acronym BFAST. BFAST is an easy way to detect stroke-like symptoms. We use it across all the communities. The B stands for balance, so sudden onset dizziness. E is for eyes. That's for sudden onset vision loss. The F stands for face, which is facial droop on either side. The A stands for arm. That could be arm or leg weakness or numbness. The S stands for speech, so you could have slurred speech or sudden onset inability to talk or inability to understand people that are talking to you. And the T stands for time. Anytime you develop one of these symptoms, it's time to call 911.
How does Baptist Health offer a different level of care for stroke patients?
So we at Baptist are a comprehensive stroke center. This is the highest tier certification that you can get from the Joint Commission, and we're very proud of it. There's a long list of things that we had to meet in order to receive this certification. And we're proud to say that we can provide the best care to stroke patients and have been proven to do that. And so we love stroke patients. We love taking care of them, and we want to do the best we can for them.
That is great. Dr. Miligan, tell us about your stroke story.
A few years ago, I had just made dinner, and the day was going great. And then right after dinner, my face went numb. I couldn't speak. It was the most terrifying thing. Can you imagine literally not being able to speak? And I remember looking at the clock and motioning to my husband who was home, and he immediately got me assistance.
Wow. Have you made any changes to your life as you've experienced
Since that time, I've become hypervigilant, even with my patients and my friends. I'm like, you could have a stroke. And, they sometimes get tired of hearing that. But I've really become more physically fit. If there's a good day, I'm outside. If there's no tornadoes, I'm outside. I'm outside trying to be active and just be as physically fit as I can and to eat more, eat smarter, eat healthier.
Did you initially know it was a stroke whenever you were experiencing symptoms?
Yes, I did know it was a stroke. I didn't know why it was a stroke. Immediately in my mind, I remember yelling to my husband, "Stroke, stroke." I couldn't say the words, but he knew seriously that it was. I knew it was a stroke. I had trained. I had worked for this hospital. I knew it was, and I had advanced training in the area, but it was me. So I knew to look at the clock. And I knew to get help.
Why is it so important to call 911 immediately when this happens?
Because 911 for most people are the go-to. They can guide you and get you to the proper facilities and communicate with you and communicate with the emergency rooms that they're bringing a stroke patient in. And it's the best way to get somebody help.
Is there anything that you would like stroke survivors to know?
Well, I think that's a good question. And I've been asked that before. I would like to tell people because it's very touches my heart because people have suffered intensely. But I want you to know that things get better and it's worth living day by day. It's worth living. Don't give up. Please don't give up because you can get better.
Is this genetic or is it just totally random? I mean, can it happen just to anybody at any time?
You know, it's all ages. I've discovered that because I've gone out and spoke so much. It's a lot of ages, and I was actually 53 when mine happened. And it's not always genetic. Usually it's just lifestyle. We found the biggest reasons there's just that being immobile and not exercising and smoking and not taking care of yourself.
So interesting. Casey, if somebody wants to reach out to Baptist for more information, what's the best way to do that?
So you can find us on our website. You can go to baptisthealth.com/stroke and find the stroke designated website. You can also call this number here on the screen, and they can help you get in touch with us.
Perfect. Great information from you ladies. Thank you so much for joining us
Thank
today.
you.